Hello, this is Lillian Butler with the Alabama Department of Rehabilitation, the State of Alabama Independent Living Program, providing training to any fiscal management agency that might be involved in our sale labor personal choices program. So, to begin, welcome to the sale labor personal choices program. Let's start at the beginning. What is a Medicaid waiver? Prior to 1991, the federal Medicaid program paid for long-term care services only if a person lived in a medical facility, such as a nursing home. It took a lot of advocacy work to convince Medicaid to waive the institutional residency requirement for people receiving long-term care services. Now, Medicaid waiver programs help provide long-term care services to people in their own homes and communities. This is often referred to as HCBS, or Home and Community-Based Services. Note that Medicaid waiver programs are an extension of state-line Medicaid, not a replacement. Waiver rules. Waiver rules are developed at a federal level by Centers for Medicaid and Medicaid Services, CMS, and handed down to the state Medicaid agencies. Each state applies those rules to their unique populations. Alabama has 7 waivers. The Alabama Department of Rehabilitation Services, ADRS, State of Alabama Independent Living, SAIL Division, oversees one of the Alabama Medicaid waivers, the SAIL waiver. The SAIL waiver has 800 slots and over 650 participants. The next question, what is personal choices? Once waiver participants begin thriving at home and in their own communities, many concluded that the program was similar to a blanket insurance policy, meeting overall needs yet neglecting individual situations that required unique solutions. They just had to convince Medicaid. Again, with the advocacy. In 2010, self-directed care or personal choices was enacted into law. Personal choices allows participants to self-direct expenditures using the money otherwise spent reimbursing direct service providers for the provision of personal care. Personal choices rules. Personal choices rules are developed by CMS and handed down to the state Medicaid agencies. Again, each state applies those rules to their unique populations. Alabama has 7 waivers, all of which have personal choices options. The Alabama Department of Rehabilitation Services, ADRS, State of Alabama Independent Living, SAIL Division, oversees one of the Alabama Medicaid waiver personal choices programs, the SAIL waiver personal choices program. The SAIL waiver has 800 slots and over 650 participants. Over 450 of those 650 plus participants are enrolled in the personal choices. ADRS culture. The mission of ADRS is to enable children and adults with disabilities to achieve their maximum potential. More specifically, SAIL helps Alabamians with the most significant disabilities achieve their independence. With compassionate, skilled, and trusted counselors, nurses, and specialists, SAIL provides in-home education, counseling, attendant care, training, and medical and vocational services to ensure independent living can be achieved at home, at school, at work, and in the community. No matter the severity of a person's disabilities, SAIL makes every effort to provide the support and services they need to live independently or to engage in employment consistent with their capacities and abilities if they want or need to go to work. SAIL's counselors serve as the family's one point of contact to coordinate combined services for homebound waiver and vocational rehabilitation participants. SAIL also advocates and strives for a higher quality of life supports participants by individualizing their services, helping individuals and families adapt to greater independence and building confidence in their abilities. It's this comprehensive and personalized approach that helps ensure our participants achieve their maximum potential. Worth saying again, it is this comprehensive and personalized approach that helps ensure our participants achieve their maximum potential. Who sells stores? The Sale Waiver Program administers services to Alabama residents who meet the following criteria: 18 years of age or older with disability onset prior to age 60, meets nursing facility level of care criteria, and meets Medicaid financial eligibility. What you may ask is nursing facility level of care. Medicaid defines it as meaning that without the services provided at home or in their living community, the recipient would need to move into a nursing. Target population. Cell waiver services are provided to, but not limited to, people with the following diagnoses: quadriplegia, traumatic brain injury, ALS, multiple sclerosis, muscular dystrophy, spinal muscular atrophy, severe cerebral palsy, stroke, other substantial neurological impairments, severely debilitating diseases, or rare genetic diseases such as Leach-Nyhan disease. SALE is a person-centered program. A person-centered approach recognizes the right of each person to make informed choices and take responsibility of those choices and related risks. It builds on the strengths, gifts, talents, skills, and the contributions of the people, of the person, and those who know and care about. Person-centered programs support people to develop the knowledge, skills, and confidence they need to more effectively manage and make informed decisions about their own lives. These programs are coordinated and tailored to the needs of each participant. We wanted to bring you some participant testimonies. Scott Brett: I like personal choices because I am in charge of the budget and savings fund. If I need extra hours, I can work them into the budget. And if I need something, I can use my savings fund and get reimbursed. I like that I can be flexible with the way my hours get used. Morning, afternoon, night. And Destiny Bailey says, I work and personal choices allows me to employ personal care workers who work around my needs and my schedule. The traditional waiver did not meet my needs because the worker was not my employee, but an agency employee. Having flexibility with my savings fund allows me to purchase supplies from a variety of sources, not just ADRS sale vendors. How it all works. Someone applies for sale waiver services with a sale waiver case manager. When declared eligible for services, the now participant elects to receive either traditional services or personal choices services. If the participant opts for the personal choices program, a sale waiver personal choices counselor will teach the program to the participant, review participant safety issues, needs, and supports, and ensure that the participant or their designated person is able and willing to take on the responsibility. Fiscal Management Services Agency applications will then be completed and submitted to FIMSA, along with the budget and authorization. But more about that. Please note that the participant is not forfeiting their state plan Medicaid service. A brief interruption to review the program is presented to the participants. Personal choices is an option for cell waiver participants that puts them at the helm of their ship and lets them set the rules. Participants assume the role of employer or attendant care, choose the direction of the financial expenditures, and take responsibility for their own outcomes. How it works: the dollars and cents. Money otherwise used to reimburse a vendor providing personal care services is set aside for the participant's use only. Example: 25 hours a week times 4.5 weeks in a month equals 113 hours. The 4.5 covers extra days in the month, then you round up. So 112.5 is 113. Then 113 hours times $17.72 equals $2,002.36. $17.72 is the current dollar amount paid to traditional care agencies or DSPs. $2,002.36 minus $98 equals $1,904.36. The $98 is the current monthly PHMSA fee. In this example, the participant's budget is $1,904.36. Note that the number of personal care hours is determined by the level of care needed. It is rare that anyone will be awarded more than 25 hours a week. So just to recap really quickly, you take the hours per week, multiply it by 4.5, round up. Then you take that number and multiply it by $17.72. And then you take that number and subtract the PHMSA fee. And what you have left is the participant's monthly budget. In this example, the participant's budget is $1,904.36. In order for a participant to access the entire monthly amount, 75% of the budget must be used to pay the personal care workers. Once that expenditure is made, the remainder 25% can be placed into the participant's savings account. In this example, we are looking at 75% of $1,904.36 equals $1,428.25. 25% of that amount is $476.09. Note that the savings account does not accrue interest and it cannot exceed 150% of the monthly budget unless approved by the sales state office. The 25% does not go into the savings account until the 75% has been spent on personal care for that. If somebody doesn't spend 75%, then they get no savings for that. How it works: the dollars and cents. Personal choices, savings, expenditures must be necessary for health or safety. Such expenditures could include, but are not limited to, dental care, transportation expenses, medical supplies, office equipment and supplies, and non-covered medical expenses. All such requests must be approved by the Personal Choices Council. How it works: on the participant side, the PHMSA acts as each participant employer's personal bank. The PHMSA keeps an accounting of all credits in each account, all debits in each account, a running balance of each account in real time. The PHMSA pays each personal care worker from the participant employer funds. Reimbursements to the employer for expenditures submitted by the Personal Choices counselors on behalf of them. How it works on the participant side, the PHMSA also acts as payroll agent. The PHMSA processes employer applications, including facilitating EIN acquisition. Employee applications, including running background checks. The PHMSA manages payroll, including processing taxes, including processing workers' compensation when applicable, and including paying taxes and issuing year-end tax documents. How it works on the cell agency side, the PHMSA acts as each participant employer's personal banker. The PHMSA bills monthly. The PHMSA fee and personal care costs, and if the personal care costs reach the 75% threshold, then the remaining 25%. So the PHMSA bills monthly, the PHMSA fee, and personal care costs. And if the personal care costs reach the 75% threshold, then the remaining 25% were saved. When it works, why it works. These are testimonials from other participants in the program. When participants experience flexibility in creating personal schedules and are not tied to agency schedules, a choice in personal care, access to the care that they need, out-of-program services for the participant paid with household income. When the PHMSA provides, that this is when it works, why it works, when the PHMSA provides an EVV app that is easy to use and easily editable for cell phone users. Human contact, not just emails. A quick turnaround time on issues. Quick enrollment, including registering budgets and authorizations. Balance sheets formatted for cell phone users. So let's walk through this with one person. Jeremy has reached a place in his disease process or has had a catastrophic event. He has heard about the cell program from someone, sometimes a friend, other times hospital staff, and often Medicaid. Jeremy or a family member or friend calls 844-602-7245 or somehow gets routed. If no one answers the phone, they will get a call back as quickly as possible, no more than 24 hours. Staff either calls back or answers the phone and talks a few minutes to Jeremy to vet him for our programs. So waiver, homebound, hybrid, and community support services. If it doesn't seem he is appropriate for any of our programs, he is directed to other community resources. If Jeremy seems like he might be appropriate for any of our programs, he is added to the referral list for this specific program and is directed to additional community resources. Walking through the application process. A case manager will then call Jeremy within a week to further vet him and to let him know he is still on the list and Cell is aware of him. Between one day and about 6 weeks, the Cell Waiver case manager will go to Jeremy's home to take an application. The case manager will get Jeremy to sign releases so that they can get his medical records. Once the application is complete, it will be submitted to the assigned Cell RN for approval and submission to Medicaid. And walking through the personal choices process. At the time the application is taken, the case manager will discuss both the traditional waiver option and the personal choices option. If Jeremy is interested in the personal choices option, the personal choices counselor in this area will be. The personal choices counselor will begin training Jeremy. Jeremy will identify a personal care worker. Both Jeremy and his worker will submit applications to the PHMSA, and once his applications are approved, personal choices services begin. What sale needs from the FEMS? Communication, communication, communication. Transparency, accountability, to include customer service representatives that can follow through to a resolution. Compliance with HIPAA, person-centered attitude and actions. Respect for both program culture and for program participants. Effective technology, a website that works consistently, an EVV app that works consistently. Easy to read balance sheets for participants. That's all for today. If you have any questions, please give me a call or email me. I'm at 334-293-7349 or lillian.butler@rehab.alabama.gov. Thank you so much for participating in this training today.